Hello, everyone. My name is Sue Barrosse. I'm Director of Admissions for Tulane University School of Public Health and Tropical Medicine. And today's guest is Clinical Associate Professor Laura Murphy. Hello, Dr. Murphy. Would you like to introduce yourself?
Yeah, sure. Thanks, Sue. Hey, I'm Laura Murphy. I'm a professor in the Global Community Health and Behavioral Sciences, GCHB. I'm also a director at the Phyllis M. Taylor Center for Social Innovation and Design Thinking at Tulane University. A long time ago, I studied at Stanford Engineering and Science and Technology Studies, and much later I earned a PhD from the University of North Carolina at Chapel Hill in City and Regional Planning. I studied population, environment, sustainable development. I've researched deforestation in the Amazon. I've worked in community development and environmental issues from Jakarta to Nairobi to Quito to New Orleans. I studied the cell phone revolution in rural Kenya. So I've had a roundabout path here. I grew up in rural California, but was eager to see the world. And I've been in New Orleans about 20 years. I lived through Katrina. I've watched the city recover. It's a great place to live.
Well, that's quite a bit of experience. Congratulations.
Thank you.
Well, I invited you here today because of your association with the Phyllis M. Taylor Social Design and Social Innovation and Design Thinking. Would you talk a little bit about that?
Absolutely. The Taylor Center is a university-wide center. It serves the campus and our community with events, programs, workshops, and various learning opportunities. We teach the skills to promote positive social change in any sector of concern. I particularly focus on design thinking. That's a creative, human-centered process of finding new and relevant, better solutions to complex social problems like access to health, safety, greener energy, finding them faster than our usual approaches.
Wow. Well, how was this initiative created, and how long has it been in effect?
Well, post Hurricane Katrina, the city emptied, the university shut down, everyone scattered across the country. President Scott Cowan then led the university towards service learning and deeper community engagement as part of the recovery of the university and the city. I was one of a cohort of different faculty from across the campus with a team from Provost and Center for Engaged Learning and Teaching. We developed undergraduate and graduate opportunities to learn skills of positive change making. And that included topics like social entrepreneurship and design thinking. We joined the movement of Ashoka and Ashoka U. Like other college campuses, we're aiming to transform higher education to promote change making. We developed classes, a speaker series, student funding, prizes, training workshops, and other programs. Phyllis Taylor, our funder, is a Louisiana native, a Tulane alum, a lawyer. Yeah, she's great. She made a gift to support these activities and with a focus on design thinking and social innovation. So the center was founded in 2014. 2014? Yeah. We're grateful for her endowment because it makes possible the work we're doing.
Yes, wonderful. Well, the term social innovation, can you explain that?
It is indeed a mouthful. The formal definition is kind of wordy. Social innovation really is about finding novel solutions to persistent social problems, the ones that we just aren't able to solve in health or education, human rights, water, where the solution is more effective, efficient, and sustainable, and where it creates value for society rather than just an individual. So really, we're looking for fresh ideas for the public good and aiming for system transforming ideas where we scale a solution through the power of networks.
Well, can you give us an example of a novel solution?
I sure can. I picked out a few, okay?
Oh,
so
good.
One of the most famous would be microfinance. This is grounded in the belief that, and in the power of the low-income poor to handle their own finances and make good investments, and in their right to banking. Social entrepreneur Mohammed Yunus of Bangladesh helped found and spread this idea widely over the last few decades. Less known is Florence Nightingale. In the 19th century, she saw the need and opportunity to professionalize nursing.
Wonderful.
More recently, Morgan Dixon founded Girl Trek. They bring a civil rights approach to the crisis of obesity among African American. She and her colleagues take women, just get them walking, right? Taking small steps towards long-term health, and they have a social movement that supports that. Just, closer to home, Tulane public health alum Anup Jain founded a social enterprise in India that supports sanitation. He did this while he was a graduate student at Tulane, and it's still spreading. Another Tulane alum, Haley Burns, saw a need to support micro entrepreneurs in New Orleans, so she founded an organization called Fund 17, right here.
Well, I actually knew Anoop when he was a student here, and I was fortunate enough to be able to learn about his work.
It's
So
great. Yeah,
congratulations to him.
Mm-hmm.
Well, let's talk a little bit now about design thinking.
Mm-hmm. One of my favorite topics. It's a human-centered approach to coming up with fresh and relevant social innovations to solve complex problems. We think of it as part of a toolkit for change makers who are looking for social innovations. And we teach it and offer it for anyone. We draw from a designer's toolkit to get creative and to make ideas tangible quickly, to try them out. We cultivate a beginner's mind and try to have a fresh way of looking at things, to be more hopeful and optimistic, which is sometimes really hard. We try to turn really chronic, serious social problems into a challenge. How might we address health systems and involving people better? We explore and define wicked problems and kind of break them up into smaller bite-sized chunks. So we think anyone can be a designer, but often we get it, kind of trained out of us. So
Right.
Or we think we're not creative. Mm-hmm. And so we all need a refresher.
Wonderful, wonderful. Well, if someone were to get involved, what are the opportunities or benefits that could be expected?
Mm-hmm. Well, the Taylor Center at Tulane serves any graduate student as well as other staff and faculty. And so we welcome anyone to come and learn in various ways, short-term and long-term. You can, learn these skills to match your technical health skills, to bring those skills to bear on a health problem that matters with the people who need you. If you're looking for job-related skills, you can enrich your resume and get the preparation you need for jobs that call for adaptable, teamwork. If you're tired of conventional ways of solving problems, you get some new skills to bring, design and prototyping mindsets. You might even need to create jobs that don't exist. It's fun and rewarding.
Definitely sounds very related to public health issues.
Yeah.
How would a student or staff get involved?
Mm-hmm. Well, like I said, the Taylor Center is a university-wide center, and we complement the training in public health. So any graduate student can come and enjoy various offerings. We provide a range of low-cost programs for students and staff and faculty. For students, we also offer training and jobs.
Good.
I just like to emphasize I have a new class this spring called Social Innovation Tools for Public Health Professionals. So you can build your system leadership and design thinking skills with a 4-credit class. It targets public health students, but also architecture or any other student is welcome if your program allows it. Mm-hmm. Faculty, staff, and graduate students can take a Fast 48 boot camp offered once a semester. It's a weekend workshop, and it's fast-paced and fun and gives a foundation in design thinking. The Changemaker Institute runs in the spring over weekends and gives students who have an idea for some social venture a way to develop that further with other people in a non-credit opportunity. Because we have an undergraduate minor, we also have graduate student training assistantships, so you can get paid to learn along with the students and support that learning. We have paid jobs.
Excellent.
At Taylor Center for open to MPH students and doctoral students. We have funding for students. You can apply for independent funding to explore
Wonderful.
some topic of interest to you.
Wonderful. Having funding is actually wonderful.
Right? Yes, so not enough students apply. So
okay. So there's a community health science focus to the social innovation.
Yeah.
Let's talk about that.
Exactly. In the School of Public Health, we have an MPH degree in community health sciences, and everyone in that degree program needs to take a kind of a focus area. So we're introducing a new content area in social innovation. It's launching now, and this class I just mentioned, a social innovation toolkit is part of that in the spring. So the School of Public Health at Tulane is unique in that it's allied with the Taylor Center, and there's various opportunities to support student learning, whatever your department. But the new focus area in social innovation is for those doing an MPH degree, and it gives you a way to focus and concentrate those skills through the classwork, and then through a practicum. That would be an appropriate practicum to practice that skill. So, engaging courses to develop the theoretical and practical tools, and then a practicum to apply it. the thinking is that employers need these skills and they can complement your public health training. And so UN agencies and NGOs and government agencies are hiring people with the profile that we're developing. So I'm excited about it.
Does sound exciting. If any of our listeners want more information, how can they get more?
Well, just email me,
Okay.
lmurphy2@tulane.edu.
Okay, and I'll be able to put that on our website here as well.
Also, you could check out the Taylor Center through taylor.tulane.edu and sign up for our newsletter. And you can learn more about the CHS Community Health Sciences degree program on the School of Public Health website.
Wonderful, and I'll be able to add those links to our interview.
Fantastic.
Well, thank you for joining us, Dr. Murphy. I appreciate all this information you've shared with us.
It's a pleasure.
All right, thank you, everyone.
Thank you.
Bye-bye.